125 years ago, Northwestern Medicine was a pioneer in the field of urology. Today, we continue to shape, define, and refine it. In 1900, under the leadership of Dr. Louis Schmidt, Northwestern Medicine established one of the first urology departments in the nation. He assembled a world-class team, and together, they advocated for accessible treatments, embraced new science, and set a course that would shape the future of urologic care. The spirit of innovation quickly became our North Star, and in 1945, under the visionary leadership of Dr. Vincent O'Connor Sr., our residency program was born. We began training future leaders, including 14 department chiefs and chairs at institutions across the nation, and ultimately set the national standard for residency training in urology with our novel curriculum. With the recruitment of Dr. John T. Grayhack came the establishment of our new urologic research lab, which emerged as a cornerstone in our academic productivity. Dr. Grayhack later became chair and would make history with his transformative research on the treatment of prostate diseases and urodynamics. The 80s were marked by Dr. Anthony Schaefer's groundbreaking discoveries on urinary tract infections and redefined how we diagnose and treat one of the most common conditions in women. As the next chair, Dr. Schaefer guided the department into a new era of research and clinical excellence. Decade after decade, our work gained momentum, and in 2001, Northwestern Medicine was awarded one of the nation's most competitive grants by the National Cancer Institute, a prostate cancer spore, an honor we continue to hold today under the leadership of Dr. Sarki Abdulkader. As the fifth chair in our distinguished 125-year history, I reflect on the accomplishments of our department and the spectacular portfolio of individuals who've gone on to transform our field. Our reputation as visionaries in the field has resulted in many of our colleagues being honored with national leadership roles, including Dr. Joshua Meeks, whose work on the AUA guideline panels for bladder and testicular cancer and the Southwest Oncology Group Genital Urinary Committee helped shape standards of care and guide clinical trial development in urologic oncology. Dr. Ashley Ross, a distinguished surgeon scientist and director of the Polsky Institute, nationally recognized as one of the foremost authorities in prostate cancer. Along with these trailblazers, our department announced 4 new specialized divisions designed not only to improve patient care, but also advance research through dedicated teams focusing on specific urologic subspecialties. Dr. Amy Krambeck, global authority on holmium laser enucleation for benign prostatic hyperplasia, was named chief of endourology and stone disease, and continues to lead advancements in complex kidney stone treatment. Spearheading our fertility preservation program for patients diagnosed with cancer is Dr. Robert Brannigan. He is appointed Chief of Male Reproductive Medicine and Men's Health and continues to head this division. World-renowned surgeon Dr. Ziho Lee was tapped to lead our trauma and reconstructive urology program and actively pioneers complex robotic techniques for upper and lower urinary tract diseases. An esteemed urologic oncologist, Dr. Shom Kundu, was named Chief of Urologic Oncology, leading our efforts in diagnosing and treating cancers while simultaneously serving as Director of Perioperative Services for our department at Northwestern Memorial Hospital. Our legacy is one of life-changing innovations and a steadfast commitment to equity and care, while masterfully bringing together scientists, clinicians, and patients. And with the newly established Northwestern Medicine Urologic Institute, we continue building the future of our field. We are proud to be recognized as one of the top urology programs in the nation. These rankings also reflect our values, relentless pursuit of excellence, and the trust our patients place in us. For 125 years, Northwestern Medicine Urology has been more than a department. We've been innovators, educators, healers. And today, we honor our past by looking ahead with purpose to continue transforming the field of urology.